Hello, everyone. Thank you so much for being here with us today. Um, this is Cindy. My name is Dan. I use he, him, his pronouns, and I'm the executive director and founder of the Cheraho Youth Task Force. I'm currently 25 years old and born and raised in Southern Rhode Island, and I identify as gay. I oftentimes find myself reflecting on what being queer means to me, and more specifically, thinking about the power of representation. Even with supportive friends and family, I felt that crippling fear of coming out. And upon coming out, I was warned countless times that it would hinder my career and that it would be something that I should keep to myself. And since then, I have challenged myself to live and love openly and to serve as representation so that other young folks in my community could have something to look up to. So while I adore my small town, I still find myself fearful to hold my husband's hand or for being outwardly gay. So I refuse to be ashamed of who I am, and I have platforms to assist me in my advocacy, and I have a support system, and it's still hard. So it's important to know that it takes an entire community to help change that narrative. So I hope together we can do more to intentionally make more inclusive spaces for all. So with that said, I'm really excited to be joined here with an incredible individual. So I'll turn it on over to Cindy.
Thank you, Dan. So good afternoon, guys, gals, and non-binary pals. My name is Cyndi Rego, and I am the State Opioid Response Grant Manager for Kent and South County within Rhode Island. I am 26 years old, pansexual, cisgender lady, and you can refer to me using she, her, or hers pronouns. I'm excited to be here today as my gender and sexuality story revolves much around exploration and knowledge seeking within the LGBT plus community. Today, I'm thrilled to be able to share some of the knowledge that I wish that I had when I was in high school, as someone who did not come out until college, not to the public or to herself. From straight to bisexual to pansexual, my sexuality has been a journey, and as it is for many others. I am constantly learning and seeking out new information to shape the way that I see my own gender and sexuality on a daily basis. That being said, while Dan and I are the grown-up versions of our former LGBT plus selves, we are constantly growing, researching, and trying to expand our knowledge, not only about our sexualities, but about the sexualities of those around us. We highly encourage comments and questions, and towards the end of our session, we have made sure that there is ample time for us to answer anything that you may have.
Great. So with that said, we present to you advice to our younger queer selves about our community and health.
So today, what we're going to be doing with you is we're going to do a brief overview of gender and sexuality, health within the LGBT plus community, and how you can make lasting impacts within your community in relations to the LGBT community.
So, sometimes it can be overwhelming, feeling like these acronyms continue to grow and grow. But know that it's important for us to know and acknowledge these sexual orientations and gender identities because they're a huge part of who we are. So just know that these letters represent some of the sexual and romantic orientations as well as gender identities within our community. So when all else fails, just ask. It's a way for us to, as Cindy was saying, continue to learn and learn and learn. So as you'll see here, we will be talking a little more about gender identity, gender expression, but let's first start by talking about orientations. And I think a really important thing to understand is A, this is a partial list, and B, there's also romantic and sexual differences. So you may have a romantic orientation and it may align with your sexual orientation, but for some of us, it might not. So I'll just go over a few of these because I think we probably know quite a few that you see on this partial list. But let's take that first bullet there. So asexual or aromantic, this is an individual that does not experience sexual or romantic attraction towards anyone. And then let's take that second bullet. This is something demisexual or demiromantic. This is an individual who experiences sexual or romantic attraction, but only after developing a very strong bond. So this is actually something I resonate with really strongly. So even though I identify as gay, this is something that I can really tag on to that identity, because that's something that really feels like it fits who I am and how I experience the world. So another one I'll point out there is pan. And you heard Cyndi mention this in the beginning, as a part of her identity. And pansexual or panromantic is an individual who experiences sexual or romantic attraction towards all genders or regardless of gender. So it's also really important that you heard both Cyndi and I both used our pronouns when we introduced ourselves. And this is a really small but important and intentional things we can do to make things more inclusive and comfortable for all. Nothing is more personal than the way somebody refers to us, and that's through our name and our pronouns. So using a person's chosen name and correct pronouns is a form of mutual respect and basic courtesy. And as you heard, I intentionally said correct pronouns. Oftentimes we'll talk about preferred pronouns, but if that's not what somebody identifies with, it really isn't a preference. It's really their correct pronouns. So oftentimes, for me, people assume the right pronouns. So that's, I'm privileged in that way as a cisgender man. However, we don't all have that privilege, and it's not for us to just assume that. So by starting off by using yours or asking what somebody's correct pronouns are is a really great way to start that conversation.
So yeah, as you can see, there are two spectrums in front of you. Dan went over the lovely sexuality and also the pronouns, and we're going to talk today a little bit about gender identity and biological sex, etc. One of the spectrums in front of you today is biological sex, which is what is assigned to you at birth by a doctor. And one is gender identity, which is what you relate to. It is important to note that these should be a spectrum. The idea of a binary or composition of only two options is not actually the true nature of sex and gender. As I stated before, I am a cisgender lady, meaning that I fall on the female side of the biological spectrum and the woman side of the gender identity spectrum. My being cisgender means that my biology and my internal composition match up. However, there are many variations in between, and just because I fall on the far right of the biological and sex and gender identity spectrums, it does not mean that I appear that way on all spectrums. In addition to gender identity and biological sex, there are other spectrums in relation to gender and sexuality. So gender expression is how you express yourself to others, gender presentation is how the world sees you, and sexual orientation is who you like. When it comes to gender expression, I would consider myself to be more androgynous, as I do not consider myself to be particularly feminine or masculine, so I identify with both of these words. My gender presentation would fall probably towards the woman's side, although it could be a little hazy, depending on how well people know me. And finally, my sexuality falls smack dab in the middle of the spectrum, as I am pansexual. Although while just looking at my gender and biological sex, you may think I fall 100% to the right end of the spectrum, it is important to note that everyone's journey is different, and things may not always be as these appear at first glance. It is important to recognize that this is a spectrum and everyone has their own individual journeys and they're worth taking a listen to. Knowing pieces of someone's identity and stereotyping them based off of all of those, only just those pieces, can be harmful, cause invisibility within some communities, and add additional stressors to those who already have chronically high levels of stress.
Yeah, no, thank you for that overview, Cyndi. I think that's a really great, even, for those who don't identify as LGBTQ plus, we all fall somewhere on each of those 5 spectrums. And, you don't have gender expression only if you're trans or non-binary. That's something that we all have. So yeah, I think that's a really great overview in things that I wish I knew more of as, my younger queer self.
Yes.
So with that said, now that we know a little bit more about our community, let's start talking about a topic called health equity. So we've probably all talked lots about equality because it sounds like the best goal you could achieve, but unfortunately equality sometimes misses the mark. So from there we really need to figure out what can really achieve that equality we are looking for, and that's actually called equity. So when we're talking about health equity, that's when everyone has the opportunity to be as healthy as possible. So to simplify that, let's take this picture here, that you see with the bikes. That top part there, equality, that sounds really fair, right? We give four people, each of them one bike. So it sounds like we have four people with four bikes. However, as you can see there, really only one individual truly can utilize that as intended. So therefore, when you're really looking at that from a fairness perspective, that's really not that fair. So same thing applies to when we're talking about health, and we'll get there in a moment. So let's take equity. As you see here in that photo, we took four different individuals. We actually looked at their needs from, the shape or size of that individual, their ability or disability, and really taking a look at what those needs were. And then we worked on fitting a bike to those needs. So now that took four different bikes because we have four different people. And now that's really achieving equity. So as we're trying to understand and ultimately achieve health equity, it's really important for us to understand health disparities and social determinants of health. So to do that, we really need to, like we did in this experiment with the bikes, really assess the needs and the differences of different communities, pockets of our population, and really at the individual level as well. So let's take a look at social determinants of health. So there's a lot of different factors that really impact our health, how long we live, and everything in between. So let's take a look at social conditions. Social inequities occur when a person or group is treated unfairly because of race, gender, class, sexual orientation, or immigration status. Economics. We're talking about things like institutions and things like governments, churches, and corporations or schools who unfortunately can use their authority to create unequal opportunities among groups of people. Then let's talk about environmental conditions. For example, where you live affects your health. Lower income neighborhoods tend to be in poor socioeconomic and physical conditions. And then when it comes to health behaviors, things like smoking, poor nutrition, and lack of exercise are all behaviors that may lead to poor health. Health knowledge also influences health behaviors. So what we mean by that is, for example, if you're not taught in a culturally relevant way about smoking or poor nutrition or the impact of exercise, then that lack of health knowledge is unfortunately going to influence your health behaviors. Then when it comes to disease and injury, things like chronic diseases or injury can result from inequities in health behavior. Genetics also influence health behaviors and health differences. And then finally, morbidity and mortality. Your social status, education, and even the zip code you live in, all in inclusion with health behaviors, all affect your life expectancy or how long you'll live.
Since being a part of the LGBT plus community can fall outside of the social norms, there are grave differences in substance use and mental health in this community in comparison to the heterosexual or cisgender communities. In comparison, the LGBT plus community is at greater risk for substance use and mental health issues, have reported more than twice as much drug use in the past year, are more likely to smoke cigarettes, drink alcohol, and binge drink, and are nearly twice as likely to have had an alcohol or drug problem within the last year. With a history of and continuation of oppression and discrimination within this community, health risks are vastly more likely to take place. When looking back, this is not surprising, as many of the safe spaces for the LGBT plus community originated in bars, raves, and generally places where drugs and alcohol were seemingly necessary to fit in.
So I think it's important to then start taking that conversation and look back at what our experiences were. So one really great way one tool we can use to do that is looking back at student survey data. So these survey, we actually have 3 slides here looking at some of our experiences. These are all from Rhode Island high schools. So as you'll see, all of these charts actually have a blue line and a green line. So that blue line is those who self-identified as straight, and that green line is those who identified as lesbian, gay, or bisexual. So as you'll see here, That's obviously does not include our entire LGBTQ plus community. And the reason is we didn't just leave that off. We left that off because unfortunately that data doesn't exist because we didn't ask those questions. So we're going to circle back and talk a lot more about that at the end, about what we can advocate for, because unfortunately we can't even reflect back on the experiences of trans individuals, for example, in our schools. So with that said, let's take a look at the experiences of LGBT students in compared to their straight peers. So when it comes to tobacco use, take a look there. More than double LGBT students smoked cigarettes than our straight peers. Then same thing, you look at a big increase there among ever trying an e-cigarette. And same thing when you look at other drug use. We have double or triple the rates when it comes to cocaine, heroin, ecstasy, and prescription drugs when used not as prescribed by a doctor.
Yeah, I think it's important to also note that when I was in high school, I did not identify with anything besides straight due to improper education and on sexuality and gender. I didn't really identify with LG or B. So therefore, the data might be slightly skewed because of that. Now in my adult life, obviously, I would fall probably towards the LG or B in high school, but it doesn't encompass everything.
No, and I think I'm so glad you brought that up. It's really important. I know even for myself, due to a lot of factors like lack of representation, to not feeling comfortable enough to be out, never mind come out to myself, I would also have answered these questions as straight. So I think while we get some data here, this is certainly not the full experiences of all LGBT young folks.
And as you can see, this trend continues into alcohol use within our high schools. So LGBT students lead their straight classmates in ever drinking, age of use, current drinking trends, and obtaining alcohol. As mentioned before, bars were a huge safe space in the LGBT plus community. So it's not unlikely that some people within the community may have utilized may have utilized alcohol at a younger age, as well as may have gotten it from an older sibling in the community, a friend in the community, a person that was older that they may have been dating in order to fit in obtaining these substances may have been a piece of that. These two things can be extremely dangerous and very illegal as well. So,
yep, no, good point. So our experiences continue when we talk about mental health, bullying, and sexual assault. So unfortunately, you see here, more than double LGBT students than their straight peers felt sad or hopeless in high schools in our state. As you can see there, more than half, in fact, of students who identified as lesbian, gay, or bisexual reported feeling sad or hopeless. And as you can see there, even more concerning, more than a quarter of LGBT students reported that they had attempted suicide prior to taking this survey as a high school student. That, concern moves forward as we're talking about bullying and sexual assault. As you can see here, more than a third of LGBT students have been bullied at school and have been bullied online. And also concerning, nearly a fifth of LGBT students have been forced to have sexual intercourse as a high school student. So obviously these experiences are really important for us to reflect back on, but it's also really important for us to know moving forward so we can help change this conversation and ultimately change these experiences so that when we look back on data like this years from now, that they look a lot different. That's that goal, right?
So as we mentioned before, the LGBT plus community face chronically high levels of stress in relation to their hetero and cisgender counterparts. Their stressors can lead to high anxiety, excess fear, isolation, depression, anger, and mistrust. Their stressors then can lead to higher risks of self-medication, using drugs and alcohol. And each community issue can be related back to the underrepresentation of the LGBT plus community within education systems, media, and so much more. Without positive and educational representation, there is an ignorance towards the community, which can lead to issues gaining health services, whether it is comfort and disclosure problems or problems understanding the patient.
And it's also important to know, like, and I think I said it in the beginning, representation matters. But it's also the kind of representation matters. So, as Cindy's alluded to a couple times now, the integration of drugs and alcohol into our community, it hasn't been on accident. It's really about the places where we've been allowed to marginally exist, but it's also about the companies and the substances that are investing in our community. So, I mean, take a look at any, queer-facing magazine or event like Pride, or really anything during Pride Month, and you see the kind of organizations who are really investing in that. And oftentimes you see a huge deal of alcohol. You also see things like, you see that ad there in the bottom left about take pride in your flavor. And I think it's also really interesting if you look into the history of these things haven't just didn't start to just start happening. Specifically with the tobacco industry, if you look at their internal documents that, because of court cases, they had to hand over, there's actually a documented history of what their marketing plan to queer people were. And they called their plan Project Scum. So Project Scum was subculture urban marketing, and that was designed to market tobacco products that we know kill 500,000 Americans every single year, and market those to queer people. So especially during a time, a couple decades ago when, it was really, it's hard now, but it was even harder to be, an LGBTQ plus person. And the only organizations that you see investing in your community and showing you representation are things like drugs and alcohol.
Makes it really difficult to stay sober, that's for sure.
For sure.
So, my friends, now you have a baseline knowledge necessary to make an impact in your community. So now what? Never stop learning, first of all, and explode out of your comfort zone. Smash the lines of comfort zone for yourself over and over and over again. It's the only way that you're ever going to learn anything new. With additional knowledge comes additional ways to help. Need firsthand experience? Join your GSA or Gender and Sexuality Alliance. At your school or even part of a community, there may be forums or things of that nature that you can find online as well. My experience, as I said before, with my GSA in college is what helped me to discover my sexuality, but it also helped me have harder conversations with people about gender and sexuality that I really knew nothing to little about. And even though the conversations were hard, like I said, I pushed myself out of that comfort zone, and that is how I ended up getting to know what I know today. So.
No, yeah, I couldn't agree more. And I think also, like you were saying, whether it's a Facebook group or a college group or a high school group, finding a place where you feel like you can connect in a judgment-free zone is really, really important. So for me, I found some of that through social media. Sometimes it often felt like I was the only one thinking this way or feeling this way in my small town. But as you start being a part of that community and realizing you're not alone, it just seems like you are, that can be really helpful. Obviously, we just saw some of those numbers about online bullying. So, social media, take it with a grain of salt and make sure it, balance is key. There's certainly pros and cons, but using it yes, but using it in a way where you can, really learn more, and feel connected is really important. It can also be a really helpful tool to help us start conversations and work to reduce stigma within our community. So, as we start to learn more and do more and see more, then we can really start to advocate for more. So we start, as we were just talking about, really changing these experiences so that, it's not just going to be this way forever. So some of the things that we can really do is start to advocate for competent care for LGBTQ plus individuals, advocate for comprehensive and inclusive data collection, and for safe spaces in schools and communities. Especially with that data collection piece right there, as simple as that sounds, if we're not collecting that data, if we're not asking those questions, we're invalidating the experiences of an entire pocket of our population. We're also invalidating, though, we're not allowing organizations, the schools, our community, or even like the work that Cyndi and I do in our communities around the state, that for us to do our work, we need data to show that need, and we need to prove that to our organizations, to our funders, and we can't do that work without that data. So if we're not asking those questions, we can't do that work. So that's a really important piece to that larger puzzle. So making sure that that first or second question on that survey, that it's already being inclusive. And I think that's really, really important. And same thing with safe spaces in schools and in our communities. If I couldn't imagine how different it would have been if I had queer educators growing up, and having representation of somebody you look up to, somebody who was intelligent and doing something incredible with their life, who also happened to be queer. And after graduating, I've learned that I did have LGBTQ plus educators growing up, but I certainly didn't know they were out while I was in school. Whether that is their comfortability, whether that's the climate of the school, there's a lot of things to kind of wade through there. But I think it's really important for the students to feel safe, the staff to feel safe, and to create that culture of inclusivity whenever possible. So that's a lot, but obviously there's so much more we can do. And Cyndi and I were saying as we were putting this together, we wish we had so much more time, because this is just the tip of the iceberg. But ultimately, I hope you learned something, because we certainly wish we knew some of these things when we were our younger queer selves. So with that said, we're really happy to answer any questions you may have. And if not, these are the ways to get a hold of Cyndi and myself. Anything else to add, Cyndi?
Thank you so much for listening. You said it wonderfully. So
Great. Well, thank you all. And yeah, we're excited to see your questions.